Hey guys, it's Dr. Justin Southall and Chase Moy from Eastern Shore Chiropractic and Sports Clinic in Fairhope, Alabama. Today we're going to discuss some of the possible causes of your low back pain, maybe your sciatic pain, maybe even if you just have pain localized in your glute. That can definitely be caused by something called your SI joint. The SI joint is made up of the sacrum, which is basically most people call it your tailbone. The sacrum here, which your tailbone is really the coccyx, but we're going to call it that, and your ilium. So you got the S and the I, and then you have one of the largest ligaments in the body right here, the SI joint ligament. So when it gets sprained or injured, then we start having instability in this joint. When we have instability in the joint, we then start to have low back pain or glute pain or sciatica. So some easy things that we're going to talk about to do is, one, go to our videos and check out the hip flexibility, low back flexibility. Look at the exercises for low back as well. These are all things that are going to help to stabilize this. But if you're currently having it and you've tried everything and you're still having the pain, or if you're just kind of pointing to that area and it's just really giving you trouble, one of the best things that we have found to basically stabilize that is the Sorolla. Go ahead and grab that. The Sorolla belt. We've tried other belts and they just don't work as well. They break down. I've had this one for over a year. I sprained my SI joint last July. Had to use it for about 3 months, and it's changed my life. So it's also, most of our patients are referring to as the miracle belt. It's changing their lives too. So I'm going to show you how to fit it. Again, it's a Sorolla belt, and we're going to put it on Chase here. So it's got a line directly in the center, and that's going to go right at the butt crease. So we're going to take it and we're going to line it up right in the center of the back, and it is going to go right over the SI joints. So here's the sacrum, here's your ilium, and it's going to go here, and he's going to grab it and turn to the front, and he's going to pull it tight, and he's going to lock it in. He's then going to lift his knee up, which the belt should fall right in this crease. And from there, the belt has elastic straps. So he's going to reach back and grab these, and he's going to pull it around and snug it around to stabilize the SI joint. So most people, that the first time they put it on, it's either, oh my gosh, it's the best thing I've ever felt, or it's not going to make much change. So if you come in here, we're going to do specific tests on you to make sure that you're a candidate for this belt. And when we put it on you, 9 times out of 10, it's going to help to stabilize that, and you're going to feel some really great results. So from here, what we would do with you as a patient was we would focus on what's causing this SI joint to be injured. Did you have a trauma? Is it just a repetitive strain issue? Or is it simply that your glute muscles are just completely inactivated? They have amnesia, they're just not functioning, and we've got to get them activated. And that's where Chase's specialty with fascial distortion, active release, as well as our functional movement screens that we do, is going to make some huge improvements with y'all. So again, if you're having that pain that's right there, or you've got that bubble that you can just feel that knot, most likely you have an SI joint sprain strain. Give us a call. We're Eastern Shore Chiropractic. Check us out on Facebook, as well as our website, easternshorechiropractics.com. Again, today we talked about the Sorolla belt. It's an amazing thing. Stay tuned for next week. We're going to talk about how to get you out of pain while you're sleeping and while you're sitting at work. Very, very key tidbits or great information for next week's video. So, again, Dr. Justin Southall, Chase Moy, we're Eastern Shore Chiropractic. We are your Fairhope chiropractor, and it's your life. Live it in health.